Afya yetu, jukumu letu. It is one thing to depend on individuals, and it is another to depend on institutions. We cannot rely on the goodness of man or woman, for that matter, to protect our workers. But in law, once it is in law, then we are protecting our workers through the law.
In every single sub-county, we have had a very good community health care strategy. Just to mention but a few, Nairobi had one of the best home-based isolation care systems among the cities in Africa, which was even recognized by the WHO because of our community health care workers.
My name is Mary Najoli. I come from Soweto East Community Unit. I have been a community health volunteer for the last 12 years down the line.
My name is Patrick Malaki. I'm a community health volunteer serving Mashimoni Community Unit. I have been a community health volunteer for the past 10 years, serving Mashimoni Community Unit Kibera.
I want to appeal to our development partners and ask you, when you think about where to put support for the health sector, we as a ministry will support that our partners focus on community health workers.
We've used these CHVs to do the registration for NHIF. That is why Nairobi surpassed. We were given a target of 66,000. We did 326,000 because we have a very good platform of community healthcare workers.
What makes me excited about today's launch is getting to see the county government dedication. It means they are ready to accommodate and to promote universal health coverage. And that starts at the grassroots level.
We have been waiting for such a launch for quite a long time, and now we thank even the government for the initiative they have taken, and also the recognition that they have recognized community health volunteers.
We cannot achieve universal health care without the support of the community health workers. I, for instance, have 2 victims that I'm helping right now. There's a young boy called Shadrach who is paralyzed from neck to bottom. Paralyzed completely. He had an accident, he's completely paralyzed. He goes through tremendous bed sores, a lot of pain. The mother cannot anymore lift him because he's now almost 18. This is where we need the community health worker to be assigned to that boy to be able to help that mother. Now, when you assign a community health worker to a family, and it is a job that requires 2 or 3 visits a week, we have to look beyond the standard stipend. The standard stipend cannot work. A mother with a disabled child is reaching a point of exhaustion and mental depression, and she needs help. So these are the people who can help. And for us to get them to help, we need to be able to allocate them assignments. And you are paid according to the assignments you've been given. Because if you're going to say, we're giving you 2,000, for instance, and then you expect them to look after 500 people, it's not possible. It's not possible. There's a lot more than just launching a law. We have to deliver universal health care, and we cannot without these community health workers.
I would like all counties to pass a bill similar to this one, so that you can be protected, so that we can protect our workers. We pass a bill like this one. The second thing is the same county assemblies, all counties, to pass a bill that leaves all money collected in hospitals, leave that money in the hospitals, so that they can be able to buy medicines. I want now to declare the launch of the Nairobi City Community Health Services Act 2019 officially launched.
So this act is very key. It is a very important act. What has just happened today, to us it's a milestone. We are actually celebrating. We feel like actually we are in a party because we've been waiting for this. Because it will see our CHVs being remunerated and being recognized. recognition is very important. They've been volunteering for long, but we never had the structures in place to make sure that they are well recognized. The work they do is very critical, especially in the COVID-19 response and ensuring that mwananchi is able to change their health-seeking behavior.
Mojawapo ya kazi ambayo nafanya kwa community ni household visits. Leo nimepanga kutembelea nyumba mbili. Nyumba moja ni ya mtoto ambaye ako chini ya miaka 5, niende kuona vile anaendelea, na nyumba ingine ni ya mama ambaye ni mkomavu, ako na hypertension, pia nitampima nione vile anaendelea. Nikipata kama wako na shida yoyote, nimebeba pia referral book yangu, nitawarifa kwa health facility ambayo ni Kibera Amref, waende wapate huduma mahali hapo. Wiki iliyopita nilikuwa nimemtembelea Mary. Wakati nilikuwa nafanya household visits, nikagundua alikuwa mgonjwa. Wakati nilitembea last week, temperature ilikuwa 39.2. Hiyo inaonyesha ya kwamba alikuwa na fever na pia alikuwa anakohoa sana, tena alikuwa na fast breathing. Nikamwandikia referral, akaenda Amref, akapata treatment. Sasa leo pia nimerudi nifanye follow up. Sasa leo nimekuja kufanya follow up, na kulingana na vile nimeona, nimeanza na kupima temperature iko 36.2, hiyo ni normal. Alafu nimeangalia kama kuna fast breathing, hana fast breathing.
Kwanza mimi nashukuru kwa huyu sister wetu, kuanzia last year tumekuwa pamoja. Hiyo wakati huyu mtoto alikuwa mgonjwa, ako na malaria, alikuwa anakohoa, ako na homa, na kutoka hiyo wakati saa hii naona anaendelea vizuri, hata afya yake naona saa hii inaendelea vizuri. Ile tu namuhimiza angalie vile saa hii vile amenitembelea, kunaweza kuwa kuna wengine wako kama plot wako na hiyo shida na wajui, tuone kama wakati mwingine hao watu wanaweza kusaidika.
Kwa majina naitwa Patrick Malaki. I am a community health volunteer na mimi na serve hapa Kibera Mashimoni. Kazi yangu haswa ni kulink my community members na health facility. Secondly, na refer my community members to the health facility wapate usaidizi ya kiafya. Thirdly, na tembelea wagonjwa wangu wale wa pale nyumbani kuweza kuwajulia hali ya kiafya. Kesi yangu nataka kutembelea leo ni mama ambaye ako na shida ya high blood pressure. Tunataka kwenda kumpima pressure yake, tuone pressure yake inaendelea vipi. Kesi yangu ya pili ni kutembelea mama ambaye amejifungua, ako na mtoto wa wiki 2. Tuweze kumshauri mambo ya kunyonyesha mtoto na kuweza kupatia mtoto, kupeleka mtoto kwa chanjo. This is one of my households, and this is a client who has been having hypertension, and I've been visiting this household for the last 2 years. This is a patient who was diagnosed with hypertension. So majorly what we do is to make sure to come to this household and check if this patient is adhering to medication, and if the pressure is okay. We see now working with the blood pressure machine just to screen and see if the blood pressure is within the normal limits, and if it's not, what can we do?
Ndobi ni kijana wangu, na tangu anichukue nilikuwa nimefinyika na pressure, ninakuwa hata sina mbele wala nyuma. Mimi namuombea sana, sababu kazi alifanya kijiji sijaona mtu ako na hiyo roho ya kufanyia watu wako na miaka kama mimi, niko na 70 years.
This time, my client has stayed for long without checking the blood sugar level, and I've taken that responsibility as a community health volunteer to refer this client for blood sugar checking. Yeah? So I think, hoping next time when I come back, I'll find this patient with the results, and also we can discuss and talk about blood sugar or diabetes with my client.
Kwa hii household, number 1 ni elderly above 60. Number 2, wakati nilianza kumtembelea niligundua ya kwamba kuna pressure. Sasa nimekuwa nikikuja kuassess mara kwa mara. Wiki iliyopita nilikuwa hapa. Alafu pia huwa na shida ya mgongo na pia shida ya mguu. Hata anatumia hii stick kwa kujishikilia. Kwa hivyo huwa namtembelea nikipata kama ako na shida yote, ni kumrefer tu AMREF aende akapate huduma, apimwe vizuri na apate huduma.
Nimemjua for 1 year. Naweza sema last year vile nilikuwa na mimba, alikuwa anakuja kwangu, ananiambia niende clinic na umuhimu wa kwenda clinic. Angekosa kuniambia mimi hata singeenda clinic juu sikuwa najua umuhimu wa kwenda clinic. Wakati wangu wa kujifungua alikuja akaniambia usijifungue kwa nyumba. Akaniambia niende kwa hospitali ndio nijifungue nikiwa salama. Nikaenda hospitali, wakati ilipofika nilienda hospitali nikajifungua salama.
Today has been a very joyful day for me because I visited one of my households, and I can see that the progress was nice, especially for the pregnant mother who was delivered. I've seen a safe delivery and a child that has been born healthy, and also the right information that was given to the mother. I could say that the information that was given to the household was properly taken into consideration. That is exclusive breastfeeding, and also just to make sure that the child starts immunization immediately. My first household, where I was looking at a woman who was having hypertension, I was impressed because the woman was adhering to medication. The only problem was that she could not get the other medication due to finance and also the unavailability of drugs in the health facility. So I would say this is one of the challenges we are encountering as our community health volunteers, where we do our referrals to the health facility, but now the community members are not able to get the right services or the correct services that are supposed to get in terms of, let me say, in terms of medication or lab requests. I would say this job is so encouraging because you can see I am serving my mothers, I'm serving my sisters, I'm serving my brothers. So it is an encouragement to me when I walk around my community. I am encouraged to see people appreciate my service and they're yearning to learn more, they're yearning to ask more questions, they're yearning to get to know more about their health issues. So I think I've been an ambassador that joins this gap between the community member and the health facility, and I'm really enjoying it.
Zile challenges napata kama community health volunteer, saa ingine unaenda kwa household, unapata ndio kuna mgonjwa, lakini hata labda hakuna chakula kwa hiyo nyumba. Pia unapata huyu mama mwenye ako na hypertension, ako na madawa, hawezi meza dawa bila chakula, inakuwa pia challenge. Challenge nyingine kama community health volunteer, tuna volunteer hivyo tu. Kwa hivyo ni kwa wadhamini, kama kuna venye wanaweza fanyia community health volunteers, hata kama kuna kitu inaweza patikana, at least wakuwa wanapata kitu, ili wakishatoka kwa field wakienda kwa nyumba wanakuwa na kitu ya kujisaidia nayo kimaisha. Pia hao wako na watoto, pia mimi niko na watoto wako shule, pia nalipa nyumba, pia nahitaji chakula. Sasa nikitoka kwa field hivyo hakuna malipo yote ninapata, lakini sitawacha kufanya kazi ya CHP kwa sababu silipwi. Ile kitu napenda ni kwa sababu ya kuona ya kwamba members kwa community wanaendelea vizuri. Challenge nyingine pia capacity building. Labda kuna mambo tulifundishwa, labda kuna mahali naweza kuwa nimesahau, labda tukikuwa na refresher courses pia itakuwa mzuri. Na pia kuna wakati kwa community tunakuanga na mambo ya action days. Action ni kitu inatakani fanyike, labda kama kuzoa takataka, unapata kwamba hatuna gumboots, hakuna rake, hakuna spade, hatuna wheelbarrow, sasa inakuwa ni challenge.
Community health has been such an impactful program that we have been involved with. We have served over 12 governments in 15 countries. And for the first time in Kenya, we have supported the sub-national level, where we have worked in 5 counties so far, Laikipia, Makueni, Tharaka Nithi, Nairobi County, where we are today, and Nakuru as well. In Nairobi County, we have 7,340 community health volunteers. They are here giving care to the urban areas, reaching the last mile, and we have been able to support the Nairobi Metropolitan Services right from when they were launching their NMS Community Health Act 2019. And that is a landmark act that will really safeguard the interests of community health volunteers, as well as putting it into law that they should be recognized, that they are the formal part of the healthcare system. And so that is really a milestone that we have been able to achieve. We are supporting Nairobi County in developing their community health strategic plan for the next 5 years. And this plan is going to spell out what will they do, how will they operationalize the act, what activities will they prioritize, what do they need to improve, what do they need to optimize, what do they do to sustain the program. Why community health? Why all these efforts where we are holding hands with partners and government to strengthen this system is because we did a seminal paper in 2015 that demonstrated a return of 10 to 1 for every dollar invested in community health systems annually in sub-Saharan Africa. And the returns are not just in terms of health, but we also have economic returns, because when we pay the CHVs their stipend, when we invest in the system, there's an economic multiplier effect. And thirdly, in terms of insurance against the next pandemics, we have all seen what a pandemic is capable of doing, ruining economies literally. So by investing in community health, there is that shield from future pandemics, because we will have a better response mechanism, and that way we will be building resilient, sustainable, and strong community health systems. Thank you.